Welcome. Today we're talking about the BLS practice analysis and what implications it has for certainly EMS educators, for program directors, as well as for EMS candidates, in particular the EMTs and EMRs. I'm Bill Seifert, CEO and Executive Director of the National Registry of EMTs. Today I'm joined by Dr. Nadine McBride. She's our Director for Psychometrics and Analytics, as well as Dr. Paul Rosenberger. He's our Content Manager for our assessment team here at the National Registry. So thank you both for joining for this conversation. Nadine, I'd like to talk with you a little bit and start off with you to find out what is this practice analysis and the specific EMT and EMR or BLS practice analysis that we recently did. Can you give us a high-level overview of what it is?
As a certification organization, it is our responsibility to make sure that we are measuring the appropriate knowledge and skills that an individual needs to demonstrate for minimal competence in their role. A certification program conducts a practice analysis about every 4 to 6 years to ensure that we are maintaining the appropriate skills that are current in the field. So we want to make sure that we're reflective of changes that are occurring as individuals perform their roles. So for the BLS practice analysis, that's exactly what we did, is we evaluated and examined the roles that the EMTs and EMRs are doing.
So the purpose of the practice analysis is to make sure that we are testing what they're doing. In other words, the exam reflects what's going on in the field. Is that what I'm hearing? I don't want to put words in your mouth, but that's kind of what I heard.
That's exactly what I was intending to say.
Okay, good.
So,
good.
It is just making sure that we are up to date with what's the role that's being performed within the field, and that we're capturing how the role has changed over the years.
Okay, good. So Paul, from an educator perspective, and we'll get more into what are the key takeaways, but on a high level, what does this mean for educators? What does this mean for EMS candidates who are going to be taking our EMT and EMR exam once this goes into play?
Yeah, so they need to look at the practice analysis and see how it's changed, because the domains are slightly different than what they have been. And inside those domains, you're going to see job tasks. And so when you look at how those job tasks are allotted, that is really telling you what you need to be teaching in the classroom. And so, for instance, I believe there's 26 job tasks in this practice analysis, and 11 of those are in patient assessment categories. So the examination is going to reflect that. And so patient assessment will be a category that the educator for sure wants to be teaching.
Good. So based on these changes that you referenced, will there be radical changes in terms of what look and feel of the exam is like, or the content of the exam? Do you anticipate any of that, either one of you?
No, I don't think so. I think when you look at the new domains, you have to help me here. Scene size up, patient primary assessment, secondary assessment, patient transport and treatment, and operations. So I think all those categories are very familiar to EMS educators and our candidates and our students.
So recently, we launched the ALS exam back in July. When with that came clinical judgment as a big component, which also has leadership and communications in it. Can you share with me, where does clinical judgment fit with EMTs and EMRs?
So clinical judgment looks a little different.
Does it?
We really wanted to focus on what does the individual do. And you will see aspects of leadership, and you will see a lot of aspects of communication, but they're embedded within the job tasks. So we took a primary focus on what does the individual do, because the roles at the BLS level do look a little different than they do at the ALS level. And we spent a lot of time with actual practitioners and listening to practitioners about what does it look like. And so we chose to focus more on the assessment component, because that's what we heard from individuals within that role, is that was their primary responsibility. And so you see a lot of that coming out, I think, in the new domain structure. And then we focused a little bit on the treatment and transport aspect, but throughout the assessment component, you will see job tasks and you will see knowledge and skills embedded within those job tasks that really focus on the communication with the patient. And then how do you respond to that? And that's a lot of what that clinical judgment model looks like, is taking in those cues and responding to them. It's just not called out in the same manner, but you will see a lot of the same knowledge and skills.
I think, kind of tap onto this. When you talk about clinical judgment, when you think about scenario testing, And that will remain at the AEMT and paramedic level, not at the EMR or the EMT level anytime soon. So although we may test those concepts of clinical judgment, leadership, and communication, it's not going to be in a scenario format.
And it's likely not to clearly be as much of a percentage of the overall exam
That's correct.
as it is for AEMT and paramedic.
That's correct.
Okay, good. How can educators, Paul, prepare themselves as educators with this new practice analysis and eventually the new test specifications as well? How can they prepare their students now with this change?
Yeah, I think really just go in and look at the document itself and become familiar with those domains, the 5 domains, and the job tasks associated with those, and an emphasis being more on patient assessment than probably what they've seen in the past. I think that's probably the biggest change that they're going to see as educators.
Okay, good. And Nadine, from a psychometric perspective, when is the next practice analysis due to be updated? You said every 4 to 6 years. So the ALS practice analysis for AEMT, advanced EMT and paramedic, I assume, is coming up next, correct?
That'll be the next on the agenda.
Good. All right. Anything else to add as it relates to the BLS practice analysis and preparing our stakeholders, educators, medical directors, state officials as it relates to this? I'm hearing as a takeaway that there's not a radical change. There are some subtle changes in terms of domain titles, but the examinations in terms of look and feel are not going to have a massive change. Is that correct?
That would be correct. Absolutely, Bill. The one thing I want to say is, like, from a psychometric perspective, the practice analysis forms what we call the content validity. And for us, a lot of that comes down to documentation on the back end. It's, can we really demonstrate that we've tied these questions and these knowledge and skills to what somebody actually does? And so we actually, like I said, we spent a lot of time with actual individuals in the field, observing them, talking to them, interviewing them, having them define these job tasks, and then surveying them to make sure that we had everything right. And so even though it looks a little different, the underlying knowledge and skills are still there. It's just that what we've done is strengthened our documentation to make sure that we, on our end, for accreditation purposes and other purposes in which we want to make sure that we have all the appropriate bits and pieces in place to show that we have built up a strong validity argument around our exams. This is a critical component. And so that's really what this is a lot of information on the back end so that we can really deeply understand the job roles that are being functioned and write questions appropriately. But what the candidates see from their perspective, they're still going to be seeing the same types of questions. The questions are going to be responding to and asking them about very similar knowledge and skills, almost identical knowledge and skills. You might see a little, like Paul said, a little bit more assessment. But in general, I don't see the candidates noticing a major change.
Very good. Anything else to add, Paul?
No, I say just work on that assessment, which is something we should be working on as educators anyways.
And I will add one thing, not only work on the assessment, but if educators work on preparing the students to function safely and effectively in the field, they're going to have no problems with the exam.
Sure. Yeah, they teach them to take care of the patient. They should have no problem with our tests at all because it is built on the tasks that they perform day in and day out.
Which is the practice analysis. So as it relates to involvement of EMS clinicians, educators, medical directors in this test development process. So Nadine, you highlighted as far as how we develop or how we did the practice analysis. What role do the EMS clinicians, do educators, do medical directors, do regulators play as part of certainly the practice analysis, but also the other aspects, the item development, the item review, the standard setting, critical. They play critical roles at that in terms of how they use this practice analysis. So can you elaborate, both of you, if you will?
Sure. You want to start at the top?
Sure. So I'm a psychometrician. I have no EMS knowledge at all.
You can spell EMS. I give you that credit.
I can spell it. That's exactly it. Somebody bleeds in front of me, I'm going to pass out. But that's not my expertise. My expertise is like the statistical analyses behind it, knowing the process and how to do it. I can't write a test question. I can't tell you what an EMS. I can only observe what they do, document it. But as far as creating a test question, knowing what to ask, knowing what the correct answer is, knowing good distractors, that's not my role. I take that information in, and that's why it's a partnership. And I always say, like, a good certification exam requires both components working hand in hand.
The content team with
the content team and the psychometrics. So we both have our areas of expertise. We can't do it alone, either silo. We're silos, like, alone, but we have to build that bridge and work together as a team. I will not write a question. I can, and you will throw it out, and it won't make it through we have a lengthy item review, revision, statistical analysis period. But what I write isn't going to make it through the process. It's never going to appear on the exam. But I can train somebody how to write a question. I can talk to them about what are the good fundamental practices that are research-based around writing and evaluating a good distractor. But I can't come up with the content, and that's where Paul and his team come in from a content perspective.
And Paul, you work with the EMRs and EMTs to write those items, correct?
Yeah. So I think about, where do external stakeholders or certified folks get involved in the process. So, when it comes to standard setting, she went out and her team went out and interviewed people and said, what is it that you do?
That's practice analysis.
Oh, I'm sorry.
Yeah.
Yes, practice analysis. I'm all confused here. So that step there, they actually identified those tasks that they perform day in and day out, and what are the knowledge, skills, abilities that they need to perform those tasks. And then when it comes to item review and item writing, which is what you asked me, was we have the providers in the field help us develop those items. We clean them up, give them an editorial review. We then shift those in front of a panel, which is composed of another group of providers in the field. And they give us feedback on those items. They give us a thumbs up or a thumbs down, depending on whether they like that item or not. After that step, it gets cleaned up one more time, and then it goes to pilot. And so then we actually get input from the candidates themselves. And then we do a statistical analysis to see how they perform. Were they too hard? Were they too easy? Do they not perform at all? And so that's kind of the process where they help us build the test.
And then it comes back to psychometrics for the standard setting. So where do the EMRs, EMTs play a role there?
But we're still just the facilitators of the conversation. In basically every step of the process, with the exception of the statistical analyses, we really see ourselves as facilitators of the process. Because what we're doing, we're taking the input in, whether it's somebody defining what the job tasks are, what the items should be, what the correct answers are. But standard setting in particular, it's critical to get that level of input, because we can talk about what is minimal competence and the entry-level provider with the knowledge and skills that they need to have, but they need to tell us. And so in a standard setting process, what we do is we have a panel of experts in EMS. So those providers are there at the table telling us through the process what needs to be involved, all the data. The data comes directly from the providers, and we just crunch the numbers on our end and the psychometrics team.
Good. So there's, throughout the whole exam development process, from the practice analysis all the way through the item writing, through the item review, through the pre-testing of items, which are using candidates, and through the standard setting. EMTs, EMRs are involved.
Sure.
Medical directors are involved, educators are involved, state regulators are involved, employers are involved. So it's a truly involved process that is related to all of our exam development cycle. So pretty heavy involvement as it relates to all the stakeholders. Paul, how do they get involved? How does someone who's watching this get involved? Where do they go to find out more information?
Yeah, they just reach out to us and let us know that they're interested in this process. And we will get them to the very next panel that we can, recognizing that we do have specific targets that we try to target on panels. And so it may not be immediate, but in time we can get people onto panels so that they can give us item review and give us feedback on the items. Do they like them or do they not like them?
And they can go to NREMT.org to find out more.
That's correct.
All right. Thank you much. Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to NREMT.org. Thank you very much. And again, stay safe.